I don't know, and I don't think he knows. I don't think anybody knows with this. This is a very tricky deal. Everybody thought the summer it would go away and it would come back in the fall. Well, in the summer it came. They used to say the heat was good for it, and it really knocks it out, remember? And then it might come back in the fall. So they got that one wrong. They got a lot wrong. They got a lot wrong. The World Health got a tremendous amount wrong.
That was Donald Trump repeating one of the many falsehoods during his Fox News interview with Chris Wallace on Sunday. So that drew, of course, a lot of criticism from medical professionals because he's just straight up basically lying. They all got it wrong. The World Health Organization, they got it wrong. Dr. Fauci, he got it wrong. Hey, you know who else was saying that coronavirus was going to disappear by the summertime? Again, it is basically getting close to the end of July, right? And coronavirus is still here. In fact, it's actually worse than it was before. When he originally said that, it's going to be gone by the summer. Well, it's not gone. It's worse. You idiot. You bungled it 100% completely. And now he's saying, a lot of people got it wrong. Everybody else got it wrong, but I was getting it right, even though I admit later that I kind of did get it wrong. But everybody got it wrong. No, not everybody got it wrong. You got it wrong. In fact, you got it wrong when you said dumb stuff like this.
It's one person coming in from China, and we have it under control. It's going to be just fine. When you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done. I think we're going to be very good with the coronavirus. I think that at some point that's going to sort of just disappear, I hope.
All that, by the way, is what, Chris Wallace's crew put together for that interview. So, look, good job, Chris Wallace, I guess, for calling him out on that stuff. That whole interview, again, pure cringe from the president, and then Chris Wallace basically debunking his garbage. So now, speaking of debunking, we're going to go to some actual medical professionals, people that are not in, the news industry or, any part of Donald Trump's administration as well, to talk about how Trump's handled this and some of his egregious claims. For example, one of the claims was that the United States mortality rate is the lowest in the world. It's the lowest in the world. We have the great mortality. No, not true. Speaking to Dr. Rochelle Walensky, Chief Division of Infectious Diseases from Massachusetts General Hospital, she explained why Donald Trump's wrong. Quote, you can measure given a patient had the disease, what's the chance they would have passed? As in not passed the disease, but had passed away. Now, she says the United States ranks about 7th in that measure, in that metric. 3% of people with with the disease in the United States had passed away from COVID-19. Now, I'm seeing this ridiculous stat from conservatives, from people who don't believe this, saying that, this virus has a 99.7% mortality rate. I'm sorry, not mortality rate, survival rate. Wow, that would be really, really bad, wouldn't it? That would be horrifying. But no, they're saying that, most of the people, 99.9% or 99.7% of people who contract the virus, they survive. It's a great survivability rate. So I don't know why you're all freaking out. In reality, it's, again, the official numbers are about 3%, which again leads to the conspiracy theories about them cooking the numbers, right? Oh no, they're making this up. They're cooking the books. I don't know why I'm doing that in the Trump voice, but again, it's what I hear. Oh, the guy dies of a heart attack. Well, then you write it down as COVID-19. Again, that's not true. COVID-19 is not necessarily a cause of death. It causes all sorts of different complications in patients. Organ failure. I mean, look, there's some of the reason why people who survive COVID-19 end up having heart problems for the rest of their lives, or at least that's what we're looking, heart problems afterwards, certainly after survival, lung problems, other organs that have been damaged during that time. And so I mean, look, there's again a lot of the virus that we don't necessarily know what the long term impacts are going to be, but from the survivors, not everything is all well and good, and so there's something that we have to look at. But going back to the 3% mortality rate, that is far larger than just the flu or the common cold that they always tend to cite when they're trying to open the eyes of the sheep, right? Uh, So now she also pointed out another way to look at this and asked what the number of people per 100,000, that's per capita, who passed in the United States compared to other countries. On that metric, the United States is third behind the UK and Mexico. So we're behind Mexico. Say, hey, all you Mexico haters on the conservative side want to build a wall, right? Well, now it's Mexico that wants to build a wall to keep Americans out because of our insane death rates in America. Okay. And insane infection rates as well. Again, we're pretty much the leaders in the world, pretty close to it anyway. Now, on that metric, again, per capita, we're also behind, let's see, we're behind the UK, again, behind Mexico. And so she says the tragic thing is that our numbers are rising because our cases are going up exponentially in comparison to the UK, where they've actually flattened the curve. Their cases are lower and flatter. And unfortunately, she says, I think we're going to surpass the UK in the number of deaths per capita in the United States. So that's a disaster. But there's more. So now on CNN, Wolf Blitzer had on another medical professional here that's basically talked about this as well, the mortality rate. He said this: we know there's a lag between tests going up and mortality rate following. Is it fair to grade the U.S. handling of the coronavirus and the mortality rate when we've also heard so many reports of lasting and debilitating symptoms from the virus? Even a lot of people who don't die are ill for months and months and may have long-term ramifications down the road. Now, before I get to the response from the person that he had on, I do want to mention, and this isn't talked about enough too, the financial costs of this virus. And look, independent media, we talk about that here because we try to give you all the perspectives. We try to give you all the information as much as we can. And I'm not saying that, there are places that are omitting this that aren't really talking about it. But at the same time, you've got channels like MSNBC that are the establishment, CNN that are, again, the establishment. When you talk about the insane medical bills that survivors of coronavirus are getting into the tens, hundreds, thousands, even, some cases, some people have had a bill over $1 million in medical costs. Well, they don't like to really talk about that as much because, it really makes the case for a single payer healthcare system where in other countries, for example, South Korea, they don't have insane medical bills like this because they have a universal healthcare system that covers every man, woman, and child that is paid for through taxation, no premiums, no deductibles, no out-of-pocket costs. And so, again, when your channel is, or I should say, when your network is funded by health insurance companies, partly, well, you tend to avoid that topic. That said, right? So we talk about that, and that is a major, major problem. So now getting to the professional he had on, this is Dr. Jeremy Faust, a physician at Brigham and Women's Hospital in Boston. Here's what he said. It's absolutely right, Wolf, and I think our report card is good on any I don't think our report card is any good on any particular metric. The mortality rate, we ought to be first. We are the country that led the way on some vaccines, has done better than anyone else on cancer. We ought to be first, but in this particular crisis, we're not first on anything. Mortality rate, testing capacity, we ought to be disturbed by that fact and start to own up to it. The world is not looking at us right now for leadership, and usually they do on issues when it comes to medical science. There are a lot of ways to look at this, and a lot of ways we have room for improvement. Look, the world is not looking to us for leadership. The world is looking at us like a pariah. Again, we're not able to travel to the Bahamas now. There's so many countries that are looking at, American tourists and American citizens going over whether it be for a vacation or a business trip and saying, no, you can't do that. We're not going to allow you. We'll allow people from the EU. We'll allow people from Canada. But if you're from the United States of America, you're banned. We're going to ban you from entry because your numbers are so out of control. That's the effect of having Donald Trump as president and having our political process be driven not by intellectuals, but by people with an ideological agenda. In this case, that agenda is anti-science, anti-intellectual. And so, in fact, it's not just they go out of their way to try to destroy academia and the sciences in favor of, again, in a lot of cases, religiosity. And so that's what we're facing in this country. And so when people don't believe in science and people don't trust the scientists and people don't trust, in some cases, in a lot of cases, the media, which is just trying to disseminate the facts, from the scientists and even has scientists on, they don't believe it. It's fake news to them because there's no trust in these institutions. It's a disaster. But now onto his statements itself. He's basically saying it very politely that we fucked up. The entire response by the federal government to this pandemic can be described as a gigantic debacle. I mean, it's an absolute disaster, and we know this. Look, just looking at the financial stuff, we've had very little relief for regular people, right? So in a pandemic, you want people to stay home. We have a political party that's actively saying, no, we don't want to incentivize people to stay home. We want to incentivize them to go out without masks and without doing physical or social distancing and to continue to consume, to buy, to go to those bars, to go to those movie theaters, to go and do things regularly, to put your kids back in school when we don't have a control over this pandemic. Again, there are some countries that have successfully been able to navigate this virus without having to lock down their economy. Unfortunately, America's not one of them because we will not, as a society, apparently we're too individualistic to mask up and to do that physical distancing. They're doing way better in Japan, and they didn't have to lock down because they followed those guidelines, because they put their community over their own personal discomfort. And that's something that we can't do here in America. So unfortunately, we're probably going to have to lock down. And if we had any sort of competent administration in place, that's exactly what we would be doing. And we would be able to give people the support they need to be able to survive a lockdown in the form of a UBI, a temporary UBI, and certain benefits. But, as well as, canceling rent for the duration. But we're not going to do that. Instead, we had massive relief for corporations, and we've got people spreading mis and disinformation everywhere. That's a recipe for disaster. And the fish rots from the head down, and it's because, again, the people with the money and the people with the power, they want the country open. They want to get back to business. They want to get back to making money. And in some ways, there's nothing wrong with that. But when you start putting the lives over, everything else when you start putting money over lives and over people, instead of putting lives first, well, then that's where there's a problem. Okay. And as far as Donald Trump's concerned, this is inconvenient for him because he was running on how good supposedly the economy was and how smart and competent of a leader he is. And that's just not true. It's just not shaking out. So he's just going to continue, though, to lie and gaslight the people, as you've seen here in this clip, and as you're going to see later on. Hey, guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.